Save My Piggies, Your Life, Your Limb, Your Story, with host Dr. John Phillips and Kim McNicholas.
I have PAD and CAD, and I'm also in recovery. So I know about the addiction. And I got 39 years clean and sober this past June. So that's awesome. But what I learned, let me say, start off with what I learned about dealing with stress. It was said earlier, first thing I do when I get stressed is smoke a cigarette because for some reason up here it helps me relieve that stress. If I get bored, my hands get bored. The cigarette. If all kind we talk about in smoking cessation all reasons why we smoke. And the next thing I want to make sure, if you're a smoker in this group, in no way, shape, or form are we downgrading you in any condition whatsoever. It is a process of learning. It is a process of recovery. And there are no one simple solutions to stop it. But we will work with you and I can work with you in any kind of situation to get you to a point where you can stop on your own. Okay. So with that thought in mind, we got to remember smoking affects the arteries. It irritates the vessels, walls, leading to plaque buildup. That's a given. It also prevents oxygen from attaching itself to the blood vessels to be effectively carried throughout the body. So we all know it's important that we want to stop all the progression of PAD, which is the number one thing of stopping smoking. So with that thought in mind, I would like to bring in one of our PAD warrior specialists that we really enjoy, Dr. Gupta, and from the state of Florida, who's a cardiologist, and he is set um, for the discussion. Now, Dr. Gupta, I have a simple question for you to start off with before we get into the conversation. How do you, how would you carry out this conversation with each of your patients about the importance of smoking cessation in dealing with PAD?
That's a good question, Doug. So I think the most important thing is to be not judgmental. When I talk to the patient and I'm getting their social history, so I will ask them about how much they're smoking, when did they start, to smoke, what is their smoking pack year history, if they're, doing any other drugs, alcohol, what have you. So as a physician, it's very important for me to be non-judgmental, first, most important. And then once I have the history, then after I have addressed the most important reason for their visit, whether it is coronary, cardiac issue, or vascular issue. So after I've addressed that, then I will bring up what we can do to prevent an event from happening. So as part of the preventive strategy, we discuss smoking cessation in a lot of detail. So typically the first visit, I will just bring up, yes, that is an issue, and we bring up strategies. I don't tell them you need to quit right now. And then I will bring them back, usually 4 to 6 weeks. Then I have another discussion. So slowly bringing up that level of trust between me and my patient, and then let them open up to me, and then we start talking about strategies to quit. And there are many, many, many different strategies to quit. What I have seen in my experience is that very close follow-ups, social support, and access to my patient helps them quit smoking, and if they're addicted to something else, then yes, that helps that as well.